Why is no one talking about the amazing journey of childbirth? It's a truly remarkable process that every expecting mom should understand. Let's take a walk through what happens during vaginal childbirth. Imagine your baby settling into a comfy position low in your pelvis. This is the beginning of the first stage of labor, which can last anywhere from 12 to 19 hours. During this time, your cervix starts to thin out and open up. You might feel strong, regular contractions every 5 to 20 minutes, along with lower back pain and cramping that doesn't let up. You might also notice a brownish or reddish mucus discharge, which is the mucus plug coming out. Sometimes your water might break in a big gush or a little trickle. When you experience any of these signs, it's time to call your doctor or midwife to check if you should head to the hospital. As labor progresses to stage 2, your cervix will be fully open at 10 centimeters, and your baby's head will start moving down into your birth canal. This stage can last from just a few minutes to 3 hours. It's pushing time. You might feel an instinctive urge to push, or you might need some coaching from your healthcare team on when to push and when to rest. During this stage, your baby's head will rotate to face your back as your uterus contracts to help push the baby down. Sometimes, a small cut called an episiotomy is made to enlarge the vaginal opening if needed. As your baby's head begins to crown and pass through the birth canal, it might look a bit elongated. Don't worry, this is normal and will go back to shape in a few days. Once the head is out, the shoulders will follow, one after the other, making their way through your pelvis. After the shoulders are out, the rest of the baby's body will slide out smoothly. And there you have it. Your baby is born. The umbilical cord will be cut, and stage 3 of labor begins. This stage, which lasts 5 to 30 minutes, involves mild contractions to push out the placenta. During this time, you can start bonding with your baby through skin-to-skin contact and breastfeeding, setting the stage for a beautiful connection right from the start. Remember, every labor experience is unique, but knowing what to expect can help you feel more prepared and confident. Stay informed, trust your body, and lean on your support team. You've got this. If you found this video helpful, give it a like and subscribe for more content just like this.